Hello everyone, my name is Giselle Eric and I am a registered nurse. The purpose of today's video is to talk about a patient case study on suspected lymphatic malignancies. I do want to kick off this video by talking about what lymphadenopathy is, and according to Gaddy and Riedel for the American Family Physician Journal in 2016, a lymphadenopathy is any abnormal growth of a lymph node, typically anything over 1 centimeter with abnormal uniformity. It consists of a proliferation of immune cells as a result of inflammatory processes, and it accounts for about 0.6% of cases that are discovered in primary care settings. Many illnesses can cause lymphadenopathy, and typically these are benign illnesses, and the lymphadenopathy can be transient when this occurs. However, a lot of physicians do become concerned when the lymphadenopathy indicates that it could be malignancy, that it has metastasized from other organs, or that it starts from the lymph nodes, or excuse me, or that it could be a more serious illness such as HIV, toxoplasmosis, or Lyme disease, just to name a few. For today's case study, I'm going to be talking about a 75-year-old Caucasian man that presented to the surgery center for an excisional biopsy of a left cervical lymph node under general anesthesia with an ENT surgeon. His past medical history was pertinent for type 2 diabetes and hypertension, for which he was taking metformin and metoprolol. He has no known drug allergies, but he did have a former surgical history of an appendectomy, a gastric bypass, and also a left corneal transplant. The patient was a former smoker. He smoked about a pack of cigarettes a day for about 30 years, and he did have a significant family history of cancer, with his father and brother both having passed away from lung and colon cancer, respectively. The patient's first encounter with the surgeon was actually in the ENT's office. His chief complaint was an enlarging lymph node on the left side of his neck. And upon physical examination, the ENT surgeon did discover a 1.5 centimeter enlarged left submandibular lymph node on our patient with no other apparent signs or symptoms. However, later in the examination, it was discovered that he did have significant weight loss compared to the physical exam that he went through back in June of 2020. He had lost about 11.6 pounds at that point. So the surgeon did send him for some specific blood work. He wanted a CBC, a comp, an ESR level, C-reactive protein, and a Lyme panel. All of which came back unremarkable with the exception of an elevated erythrocyte sedimentation rate. And according to the Mayo Clinic, the erythrocyte sedimentation rate is an inflammation marker. It measures the rate at which red blood cells fall to the bottom of a test tube, and the faster that rate is, the higher the chance of having an inflammatory process going on is. So in the case of our patient, his ESR level was 28 millimeters per hour. And for a normal male, a normal range would be anywhere from 0 to 22 millimeters per hour. The patient 2 days later after his visit in the office also underwent a fine needle aspiration biopsy, which revealed to be positive for monocytic CD10 positive B cells. Now, according to Almastri et al. For the Archive of Pathologic Laboratory Medicine in 1998 revealed that the presence of CD10 enzyme is usually expressed on germinal cells, and it could account for the formation of lymphoma. It actually accounts for about 89% of follicular lymphomas and about 56% of other B-cell lymphomas. According to the Lymphoma Research Foundation, the suspected pathology for the presentation of our patient with the unilateral lymph node enlargement, the elevated erythrocyte sedimentation rate, as well as his rapid weight loss could indicate that he could have follicular lymphoma. It is really hard in the setting that I work in at an ambulatory surgery center to follow up with patients that come through presenting signs and symptoms of an illness, especially after they're having a biopsy. Typically, those patients do not come back to the setting, and if they do, it would be for any other further biopsies. So still working with pathology. Follicular lymphoma is a type of non-Hodgkin's lymphoma that is typically slow growing and slow developing, but it does start off as an enlarged lymph node on one side of the body, typically on the cervical lymph nodes of the head and neck. According to Crandell et al., for the Journal of Clinical Investigation in 2012, the treatment for FL includes radiation, chemotherapy, monoclonal antibody therapy, but a lot of oncologists will actually use the wait and watch approach for patients, especially if they're not having any symptoms or if their symptoms are limited to just the inflamed lymph node. Losses and Gascoigne, for the best practice and research clinical hematology journal in 2011, did describe follicular lymphoma as being incurable, with the rate of survivability being about 8 to 10 years for patients from the minute that they are diagnosed. Rituximab is the first-line medication along with radiation therapy against follicular lymphoma. However, the fear is that it will commonly turn into a more rapidly progressing form of lymphoma known as diffuse large B-cell lymphoma, and it could indicate a poor prognosis for our patients. Low hemoglobin levels and elevated ESR levels can also indicate the survivability rates for patients. Nursing considerations for patients diagnosed with follicular lymphoma are focused around the concepts of uncertainty for patients. It can be really distressing for them to have a diagnosis of an incurable illness. So it is important for medical professionals to include support, assessment, education, both of the family and patient, and management of symptoms of any sort of treatment that they might be going through at the time. It can be particularly distressing for patients to go through the wait and watch period that some oncologists will go with. So it is important to give them the tools for them to go into the community and use some of the resources when it comes to respite care, end of life care, making medical decisions, setting advanced directives, and also going to therapy for potentially any psychological issues that they might develop from the treatment, such as anxiety and depression, just to name a few. Being diagnosed with a malignant lymphadenopathy, such as follicular lymphoma, can be really distressing for patients. It is important for medical professionals to provide a lot of support, not only to get the patient through the physical period of the illness, but also the psychological effects of it.